Hello guys. So yesterday we completed oligohydramnios, polyhydramnios and all the other related abnormalities of amniotic fluid. So today we are going to talk about fetus and its development. So let's start. Do you know the difference between gestational age and fertilization age? Fertilizational age? Right. So whenever we say that this female is 20 weeks pregnant or 36 weeks pregnant, where are we actually counting from? We are counting from LMP, the first day of the last menstrual period. Okay, but in embryology, when we say that implantation starts at day 6 and is completed by day 10, so here day 6 and day 10 are counted from which day? They are not counted from LMP, they are counted from the day of the fertilization. Okay, so most of the time in embryology we use fertilization point as a starting point, and in OBS we use LMP as a starting point. Okay, most of the times. Now we divide as you all know that we divide the pregnancy into 3 trimesters, first, second and third. So first trimester is from 1st to 14 weeks, second is from 14 to 28 weeks, and third trimester is 28 weeks onwards. Okay, 28 to 40 weeks is the third trimester. Okay, now in these different trimesters we have different criteria to determine what is the fetal age on the USG. Anyway, we can determine the fetal age by LMP, but in case the mother does not remember exact LMP, or she is doubtful about LMP, we can always find the fetal age with USG. So the earlier we do the USG, the better results we'll get, or more accurate we will be in determining the fetal age. So in the first trimester we have CRL, crown rump length, as a marker for fetal age. So it's from the tip of the head to the coccyx, that is crown rump length in the first trimester. In the second trimester we have biparietal diameter, okay, BPD, biparietal diameter, and in the third trimester we measure the femoral length. Okay, so depending on these values there are complex formula which the USG machine uses and gives us the estimated age of the fetus. But this is for the age. What about the fetal growth? How do we determine how is the fetal growing, or is his weight, or is he growing according to his age, or is he lagging behind? So for that we use abdominal girth or abdominal circumference as a marker. So for determining IUGR or macrosomia we use abdominal girth. Okay, and for monitoring fetal weight we have a formula called as Johnson formula. Okay, I'll give you a homework. Suppose the fundal height is 30 centimeters. Let me know in the comment box what will be the fetal weight. Okay, and there is another rule which is Hess's rule. It helps us to find out gestational age if we know the fetal length, or we can find out fetal length if we know the gestational age. So if the female is less than 5 months pregnant, like roughly we know that she is less than 5 months pregnant, then the formula is root of fetal length, gives us gestational age in months. So from the USG we find out that the length of the fetus is around 25 centimeters or 20 centimeters. So we take the root of 20 and we get the gestational age in months. Okay, and if the female is more than 5 months pregnant, so the formula is fetal length by 5 divided by 5. So if the fetus is 35 centimeters long, then 35 by 5 is 7. So the gestational age is 7 months. That is Hess's rule. Okay, now let's talk about the development of the fetus. Right. Before that, do you know about hematopoiesis in the fetus? In the first few weeks, it happens in the yolk sac till around 6 weeks. After 6 weeks, liver takes over, and from 6 to 20 weeks, liver is the main source for hematopoiesis, and after 20 weeks, bone marrow is the main source. Okay. Now, in pediatrics, as we see the development of child, like what he does at 3 months, what he does at 6 months. Similarly, we are going to see about fetus. week wise. Okay, so at 5th week, and mind you, these weeks what we are talking about is from the LMP, not from the day of fertilization. Okay, so in the 5th week, the heart of the fetus beats for the first time in the 5th week. Okay, now in the 7th week, this may be slightly more boring or rectifying, but bear with me, right? So now we saw about 5th week. So in 7th week, the fetus starts his movement for the first time. It's perceived later by the mother, but the movement starts at 7th week. And also, if the fetus is a male child, male fetus, then there will be development of testis by 7th week. In the 8th week, ovaries develop if she is female, and an hormone which is glucagon starts secreting at the 8th week. Now between 9 to 11 weeks, there are many things happening. So the urine formation starts, insulin secretion from the pancreas starts, the fetus starts to swallow. He is able to swallow between 9 to 11 weeks, and by the 11th week, there are breathing movements, chest wall movements in the fetus. Okay, so these are the 4 things we saw between 9 to 11 weeks. Now 12 weeks. If she is female, by the 12 weeks, her external genitalia will develop. So see, first testes develop, then ovaries, then female genitalia, and then male genitalia. So male genitalia develops at around 14 weeks. Okay. Now coming down to the 16 weeks. At 16 week, the meconium production starts by the fetus, by the liver of the fetus. There are some lanugo hair appearing, and 16 week is the time where the mother perceives the movement of the fetus. Okay, between 16 to 18 weeks, the mother starts to perceive that the fetus is moving, which is in the second trimester, initial period of the second trimester. Now in the 20th week, there is surfactant production, but it is only inside the lungs. It is by the type 2 pneumocytes. By the 28 weeks, we can find this surfactant in the amniotic fluid, but in the lungs it is produced by, the production starts by 20 weeks. Okay, at 24 weeks there is keratinization of the skin. So that's why after 24 weeks, skin cannot play any role in absorption or secretion of amniotic fluid, because there is keratinization by 24 weeks. And as I said, at 28 weeks we can detect surfactant in the amniotic fluid. Okay, now let's talk about, this was about the development of the fetus. Try to relate this with other systems. When you are reading other topic, try to relate this development so that you will remember. Now let's talk about alpha fetoprotein. Okay, alpha fetoprotein is a protein which is secreted in the fetus, mainly by the liver of the fetus, but we don't know what exactly is the function of alpha fetoprotein. Apart from its function being to carry certain ions or certain substances in the fetus, we don't know what the exact role of alpha fetoprotein is. But we can make use of alpha fetoprotein to diagnose certain congenital anomalies in the fetus. Okay, the fetus produces this alpha fetoprotein. It comes into the amniotic fluid, and eventually it also comes into the maternal serum. So we can measure the level of alpha fetoprotein and we can detect any congenital anomalies. For example, if the fetus has neural tube defects like anencephaly or any other type of neural tube defects, any abdominal wall defects, omphalocele and pilonidal sinus. So in these three conditions, alpha fetoprotein increases. Whenever we measure this alpha fetoprotein in the maternal serum, it increases. Why does it increase? The theory behind this is that in all these three conditions, neural tube defect, abdominal wall defects and pilonidal sinus, there is some opening in the fetus. So this alpha fetoprotein leaks out from here. Like in the abdominal wall defects, there is a defect in the abdominal wall. So this alpha fetoprotein leaks out. There is increased amount of alpha fetoprotein in the amniotic fluid and also in the maternal serum. So whenever there is opening or whenever there is a defect, there is high alpha fetoprotein. And in other cases, like if there is abortion, the fetus is aborted, he cannot produce alpha fetoprotein, so there is decreased level of alpha fetoprotein. Other conditions are trisomy 21 mostly, Down syndrome. So in Down syndrome, the yolk sac and the liver is smaller, so the production of alpha fetoprotein is also less. Okay, so these are the conditions where alpha fetoprotein is increased and decreased. Okay, so I think that's all for today. I know there was a mugging part in between the development of the fetus, but keep revising it, you'll eventually learn it. So that's it. Bye, see you in the next podcast. Till then, keep studying and enjoy.